Patient is to be given 500 ml of medication over 5 hours. What is the drip rate of the IV fluid? Use drug factor 20 drugs per ml. Don't forget, we're still on our CBT preparation lessons, and in this video I'm going to talk about the drug calculation formulas. We're going to dive into all the formulas you need to possibly do with your drug calculation so far as the CBT test is concerned. So if you are struggling with your drug calculations or you're not too confident in that, then this video is going to take you through everything about it. Okay, my name is Esther Kwadma. You can simply call me Kobe. I'm a nurse by profession and a content creator by passion. If today happens to be your very first time seeing me, what I want to say is that hit the subscribe button and become part of the family, so that anytime I upload a new video, you'll be the very first person to get to watch. And above all, don't forget to like and share this video because there's someone else there seeking to have it. Before we start, I want to put this disclaimer across. I'm not really a certified CBT tutor, or I've not been accredited to teach CBT. But whatever I'm doing here is based on my experience and my knowledge. What this means is that I have ever sat for the CBT, so I know how it goes. So whatever I'm going to teach you here is applicable on the field, because you'll be giving medications in the form of tablets, in the form of liquid, in the form of IVs, and so on. You've got to know how to calculate them based on the right formula. So now let's jump right into it. We're going to possibly look at how to calculate for tablet medications or capsule medications. You see, as a nurse, one of the medication forms you will give, the most common medication forms you give will be tablets or capsules. Okay, so it's up to you to know how to calculate for each of these capsules, so that at least you are confident that whatever you're giving to the patient is the right dose. When you look on the boards, there are a couple of things I would want us to look at. Now, to be able to calculate for a drug or a tablet or a capsule, what happens here is that you've got to use the right formula. So as you can see, the formula on here happens to be the number of tablets is equal to prescribed dose divided by stock strength. Now you'll be asking, what is the prescribed dose and what is stock strength? I'm going to explain, so that at least it's much easier for you to fish out those stars in the question. So when we say the prescribed dose, what we mean is that it's the number of tablets or the amount of medication the doctor wants you to give to the patient, and the stock strength is the strength or the form of dosage with which the tablet comes. So let's say you pick a box of amoxicillin. So as you can see on here, a patient is prescribed 750 milligram of amoxicillin. Amoxicillin happens to be an antibiotic. It comes under the penicillin group. So if you have a patient on this medication, then it's being given because the patient has got an infection sample or whatsoever. You could see that this is the form or dosage the doctor wants us to give. So that will be the prescribed dose. And mostly you see the verb prescribed to tell you that happens to be what the number of tablets or amount of medication the doctor wants you to give. So now let's pop that down, 750 milligram. Okay, that happens to be the prescribed dose. The tablets available are 250 milligram each. The stock strength happens to be the dosage form, the actual dosage form which the tablet or the medication comes in. So let's say you pick a box of amoxicillin, which happens to be an antibiotic. Now when you look on the box, you can see that they've written the dosage that says 250 milligram each, or let's say 500 milligram each. Now we're looking at this question. It says the tablets are available in 250 milligram each. What this means is that if you pick the box of the amoxicillin, you should see this dosage written on it. So that happens to be the stock strength. So what you're going to do here is that to be able to calculate for the number of tablets, you need the prescribed dose all over the stock strength. So now let's do that. Stock strength here is 250. So now this milligram cancels this milligram, 0 cancels 0, and then 25 goes into this sub 1 and goes into 75. 3. What this means is that we need 3 tablets to match up to the dose the doctor has prescribed. So this is something you have to keep into consideration, or you have to keep in mind. So now I've got a trial question for you. What I want you to do is that try your hands on this and let's see if you really understand whatever has been described or talked about in the previous slide. It says on here that the doctor orders 1 gram of metronidazole for a patient. Tablet comes in 500 milligram. How many tablets are needed? in actual sense, you can quickly get the answer of it. But the question is it really correct? You need a formula to be confident to say this answer is written down is correct or not. So I want you to spend about 1 minute or 2 minutes to get this done. And then probably you go through it and see if whatever you've done is correct or not. Let's see if we got the answer right. So as you can see on here, the doctor orders. So there's the prescription, okay? The doctor prescribes or orders 1 gram of metronidazole for a patient. The tablet comes in 500 milligram. How many tablets are needed? So there is something you have to keep into consideration. You're looking at the number of tablets we need for the patient. Now we're going to pick up the formula. The formula says number of tablets is equal to prescribed dose. So let's represent that to TD over the stock strength. So the question you should be asking yourself, what is the prescribed dose? The question makes us understand that the prescribed dose here is 1 gram. And then the stock strength happens to be 500 milligrams. But you could see that the units are conflicting. In the prescribed dose, you have gram, and then in the stock strength, you have milligram. So in actual sense, you've got to convert the units to make it 1. So you're going to convert the 1 gram into milligram. So the question you should be asking yourself is how many milligram will give you 1 gram? So we know 1000 milligram matches up to 1 gram. Now let's pop that into the formula and then let's see. Prescribed dose here, instead of 1 gram, we're going to write 1000 milligram, all divided by the stock strength, which is 500 milligram. So that will constitute the number of tablets. Now we're going to do our cross offs. Milligram cancels milligrams. These 2 zeros will cancel 2 zeros. Now we are left with 10 divided by 5. And you pick a calculator and then you pop that in there. So on the CBT exam, you have a calculator somewhere and then you should be able to use that to calculate. But off it, you can see 5 goes to the base of 1 and then goes into 10, 2. So here the answer is 2. What it is that the number of tablets we need to be able to match up to what the doctor has prescribed is 2. So 2 tablets. What it is that we need 2 500 milligram tablets to make up 1 gram of metronidazole. So let me just know in the comment section if you had the answer right. If you had it right, let's clap for yourself. You're doing very well. Okay. Alright, so the next thing we're going to look at here is how to calculate for liquid medications. You see, as a nurse, you may testify to the fact that not every patient can take tablet or capsule medications. In actual sense, the form of the medication needs to be changed, and most times the preferred one is a liquid medication. So we're going to learn how to calculate liquid medication so far as the CBT is concerned. And what I also want to say is that whatever you're going to learn here is applicable as a nurse in the UK. So take it very serious, okay? Now, to be able to calculate for lipid medications, it's very simple. You've got to clinch onto a formula. And as you can see on here, to calculate for the volume of a medication, you have to consider the prescribed dose divided by stock strength or multiplied by volume of the stock solution. In the previous slide, I explained what the prescribed dose is all about, which I believe you still remember, and then what the stock strength is about. Now, I'm only going to talk about the volume of the stock solution. I'm sure you might have come across a liquid medication in a bottle. When you pick the bottle up, you will see that on the bottle, there might be an inscription with something like 250 milligram per 5 ml. So you could see that a 5 ml happens to be the volume of the stock solution. What this is that for every 250 milligram of medication, so let's say 250 milligram per 5 ml, it means that per every 250 milligram of the medication you give, it converts to 5 ml. Or in actual sense, if you give 5 ml of this medication, you are giving 250 milligrams. So that is the concept I want you to keep in mind. And this is the formula we're going to use to calculate for liquid medications. So anytime you miss such in your CBT, don't forget this formula. So let's look at a similar question down here. It says you have to give 100 milligram of a medication. So let's keep the keywords in mind. Give here means that is what the doctor has prescribed. The label says 200 milligram per 10 ml. How many ml would you administer? Please use the correct units. Now, the first thing I advise you do is that you should be able to pick up the right numbers and match it up with the parameters in the formula. What do I mean by this? Let me show you. Let's pick up the prescribed dose as it is in the question. So it says you have to give 100 milligram of a medication. The 100 milligram here transcends into the prescribed dose. That is how much the doctor wants you to give. Let's pop that on here. 100 mg. And then the next thing we want to look at is the stock strength. So normally when you look on the bottle, as I explained, you see the stock strength. In the CBT, most times if you have a picture of that medication, you have to pick the stock strength from the bottle. But here this is in the question, so that is something to take into consideration. So normally the stock strength is attached to the volume of the medication. So as you can see on here, 200 milligram per 10 ml. So the stock strength here is 200 mg, and then the volume of the stock solution is 10 ml. Okay, so as you can see on here, so 10 ml. We're going to plug these parameters or these numbers into the formula, and then we see what we get for that. The volume of the medication can be calculated as prescribed dose, as you can see on here. So that is 100 mg, all divided by stock strength, which is 200 mg, times the volume of the stock solution. So that is 10 ml. Okay, so let's do our process. Milligram cancels milligram. These two zeros will cancel these two zeros. So in actual sense, we have 1 divided by 2 times 10 ml. 2 goes into itself 1 and goes into 10, 5. So you can see that 1 times 5 is 5. So we have 5 ml. You can see that it says please use the correct units. This is very important. The question says how many ml. So that is the correct unit you've got to attach to the value you've got. And always make sure that the ml is written in this manner: small m, capital L, don't add s. So in actual sense, if you as a nurse give 100 milligram of this medication to the patient, it converts into 5 mils, or for every 5 mils you give to the patient matches up to 100 mg. It's as simple as that. So the next thing we're going to look at is a trial question. I want you to try your hands on this using this explanation, and let me see if you understand. I'll just give you a few minutes and probably pop your answer in the comment section, and let's see how that goes. Okay, let's look at this trial question. It says a patient has been prescribed a dose of 75 milligram of a medication, and you have 150 milligram per 5 mils. What volume should be administered? So here you can see that instead of these, your what ml should be administered. They are using what volume. It's the same thing. Don't let that confuse you. But the most important thing is for you to fish out the individual parameters in the formula. So now the question is, what formula are you supposed to use? So as much as possible to keep the formulas in mind, so that at least if you get that, you know which formula to quickly use. In actual sense, you can get the answer off here. But as I always advise, it's much better you plug these figures into the formula, and you know that the answer you are getting is actually right. Okay, so here we're going to pick up the right formula, which probably we know already. So volume of the medication, okay, is equal to the prescribed dose, all divided by stock strength times volume of the stock solution. So the question you should ask yourself is, what is the prescribed dose on here? So as you can see in the question, a patient has been prescribed a dose of 75 milligram of a medication. The prescribed dose here, as we know, is 75 milligram. And then stock strength. So normally you can find that coming in this form, 150 milligram per 5 ml. So mostly the stock strength is attached to the volume of the stock solution. So this happens to be the stock strength, 150 milligram. So 150 mg times the volume of the stock solution, which is 5 ml. Okay, 5 ml. Alright, so we're going to do our process and then we see what we get for that. Milligram cancels milligram. We have 75 all divided by 150 times 5 ml. Now you go to your calculator and then punch that into it. It's as simple as that. And one thing I want to advise is that always make sure that you're adding the units as you do your workout and stuff, so that at least you know which one crosses which one, and then the remaining one becomes the actual unit you are supposed to use. Because always the question will say, please use the correct units, as you can see on here. Alright, so let's grab our calculator. You see 75 divided by 150 times 5. And then the answer we're getting here is 2.5. Okay, so let's 2.5 ml. Remember the correct unit. The answer here is 2.5 ml. What this means is that for every 2.5 ml you give to the patient equates to 75 milligram. I'm sure you've really understood the concept of calculating for liquid medications. Whatever you're learning here is applicable in the field of nursing, so probably just take notice of that, and you are likely to meet this in most of your medication rounds and stuff. So at this point, if you like what I do and you are really benefiting from it, I believe that there is someone out there who is also willing to see this as well. So please endeavor to share, and don't forget to subscribe so that anytime I upload, you become the very first person to get it. We're going to talk about how to calculate for infusion rates. This is where most people find difficulty, and I'm going to try as much as possible to explain this to you in details. So for those who watched the day 3 lesson, there are a couple of stars that came in up there, and I mentioned to you guys that I'm going to take time to explain this. Okay, so let's start. As a nurse, one thing you won't ever miss is giving IV infusion. So when we say IV infusion, it may come in the form of giving a normal saline, giving a Hartmann's, giving 5% dextrose. So as you can see on the screen, you might have to give them an infusion pump, and as an international nurse seeking to work in the UK, this is one of the stars you commonly meet. We're going to calculate the IV infusion rates. In the detailed lesson, I made mention of the differentiation in here. We have IV infusion rates and we have the drip rates. So in actual sense, sometimes you see calculate the rate of the medication. In other times, you also see calculate the drip rate of the medication. These are two different things. But for the sake of this slide, we're going to focus on the rates or the IV infusion rate. Okay. So as a nurse, there may be a point that a doctor writes a flu prescription, comes to you and say this patient needs maybe normal saline for 8 hours, for 10 hours, for 12 hours, and they show one at this specific rates. But one thing you should understand is that most times the doctors will only write the volume of the medication or the IV infusion and the time. They won't write the rates. So what happens here is that you've got to find out what rate that medication should run for that amount of time, and that is how come the IV infusion rate comes in. So you should know how to calculate that. To be able to calculate for the IV infusion rate, you need this formula. It's very simple. So it's total volume in mils times time in hours. It's actually simple. We're going to look at a similar example down here. A patient is to receive 500 ml of 5% dextrose solution over 4 hours. What is the rate in mils per hour? So you can see that the total volume should always be in ml, and then the time should always be in hours. Yeah, and most times the question should meet in your CBT may be in hours. So it's up to you to try as much as possible to work it out. And if it's in minutes, what is this time? You've got to convert it into hours. Alright, so let's pick the parameters on here from the question. Total volume, I'll represent that with TV, is equal to 500 ml as stated in the question of 5% dextrose. Now let's pick up the time in hours. That is 4 hours. To calculate for the rate, you have to punch these figures into the formula. And here, rate is equal to total volume, which is 500 ml. Always remember to add the unit so that it makes it easier for you. All divided by 4 hours. So we're going to punch this into our calculator for each axis, and then we look at what the answer is. 500 divided by 4 is 125. So the answer here is 125 ml per hour. Let's write that in here. So you can see that most times the unit to be added. So all you've got to do is to just write 125. But in some cases, you have to add the unit yourself. and which I believe you should know. I remember the medication is meant to be given for 4 hours. So per every 1 hour, 1 hour, 1 hour, 1 hour, every 1 hour, 125, the volume of 125 ml should go into the patient's vein or into the patient's body. So that is the simple explanation. So the first hour, 125 should go in there, the second hour, 125, the third hour, 125, and then the fourth hour, 125. So when you put all these together, it sums up to 500 ml. And one important thing I want you to keep in mind is that when we say the rate in mils per hour, then it means that the IV fluid is going to be run in an infusion pump. So as you can see on here, this happens to be an infusion pump. And most times, once you pass the volume of the medication in the pump and then the tide, it will automatically calculate the rate for you. But remember, in the CBT exams, you're not going to get a pump or something like that. You got to do the calculation on by yourself. Now, the next thing you're going to do is I want you to try your hands on one of the very questions and just see if you really understand whatever has been discussed on here. And if you've got any further questions, don't forget to leave that in the comment section. So this happens to be a trial question. Patient Y is to be given 1000 ml of fluid over 8 hours. What is the rate in ml per hour? So the very first question you ask yourself is, what does this imply? Is the infusion going to run in an infusion pump or just through a normal digging set where you have to automatically calculate the drip rate? So for us, you see it this way, means it's going to run through an infusion pump. But for the CBT, you've got to do the calculation all by yourself. By an actual sense, the pump will calculate the rate for you once you punch the volume of the medication and that of the time. Let's look at the next thing to consider. That is the formula. In the previous slide, we said the rate is equal to total volume of the medication, which should be in ml, all divided by the time, which should be in hours. So now we're going to put the values in the ask yourself in the question, what is the total volume? The question has specified that it is 1000 ml. And then the time on here is 8 hours, all divided by 8 hours. We've got to punch this into our calculator and see what values we're getting. And probably once you get the answer, I would want you to leave the interpretation in the comment section. I just want to know if you understand, okay? 1000 divided by 8 is equal to 125 ml per hour. So the answer here is 125. So how do you interpret this? Let me know in the comment section. Alright, so this happens to be another important session you are likely to meet in your CBT, and you should be able to prepare for that as well. Now, you may be asking, what is the drip rate? It still relates to the IV infusion, where a doctor prescribes normal saline, 5% dextrose, 10% dextrose, potassium, KCl, and all those stuff for you to keep to a patient over a specified time. Let's say 12 hours, 10 hours, 11 hours. But most times you may get 4 hours, 6 hours, 8 hours, and 12 hours. But here, it's a bit different. And that is what we're going to look at in this very section. One thing you should understand is that, as I explained previously, when a question says calculate for the drip rate, is different from what is the rate in mils per hour. The formula to calculate for the drip rate is the total volume in mils all over time in minutes. So note the difference. The rate is in hours so far as the time is concerned, and then here a drop factor. You may be asking, what is the drop factor? I will explain that for you to understand, so that at least whatever you're doing, you know exactly what you are up to. I want to reiterate the difference between the rate and the drip rate. So let me just write that on here and then let's see. So this is the rate in mils per hour and have the drip rates. So this is in GTT per minute, which is drop per minute. So this is the unit for drop, and then that's the unit for the time. So yeah, note the difference. Secondly, when we say you have to calculate for the rate, remember the infusion is going to be run through an infusion pump. And when we say calculate for the drip rate, here you are going to automatically calculate how much drops should fall in the chamber and how much of that should go into the patient within a specified number of time. So that is something you have to take into consideration. So as you can see the picture on here, it's much more like doctor has said to you, I want you to give 250 ml of normal saline for 30 minutes. This time, we're not going to run that through an infusion pump, but you want to be able to calculate how much drops goes into the chamber and that of the patient at a specified amount of time. Drip rate, you are not using an infusion pump, so you're going to do a manual calculation. Let me put it that way. What is a drop factor? I'm sure that happens to be one of the important things you're asking. When we say a drop factor, it's a very simple thing to understand. So before the medication goes into the patient, it goes through the chamber. So as you can see, a couple of drops fall into the chamber, and then gradually it moves through the tube down into the patient's cannula. With the drop factor, we're looking at how many drops fall into the chamber a ml. So for every 1 ml is equal to how many drops. And let me explain this. This you don't always have to worry about it so far as your CBT test is concerned. It's just because most times the drop factor will be given, as you can see in this question. Drop factor is 20 drops a ml. What this means is that for every 20 drops that fall in this chamber is equal to 1 ml. Let me know if it's really confusing, and I'll try as much as possible to expatiate a bit more. Ask yourself, how many drops? Let's pop that on here. How many drops make 1 ml? That's the actual sense, and that is normally what the drop factor is all about. And one thing I want you to understand is that IV fluids are normally given through giving sets. We have different giving sets. We may have a giving set that can give 20 drops per ml. We have a giving set that can give 15 drops per ml. We have a giving set that can give 60 drops per ml. So most times the drop factor will be on the giving set. So as you can see in the picture, this picture is standard giving set, okay? And the drop factor here is 20 drops per ml. What this means is that for this giving set, for every 20 drops that fall in the chamber is equal to 1 ml. So if 40 drops fall in the chamber is equal to 2 ml. If 60 drops fall in the chamber is equal to 3 ml. So this is something you have to take into consideration. And most times, if you are calculating for the drip rate, you'll be given the drop factor in the question. Or sometimes the question will give you the total volume, the time, the drip rate, and you'll be asked to calculate for the drop factor, which is not mostly common. So this is something you have to take into consideration. And I believe with this explanation, it's much clearer. Alright, so with this understanding, let's look at the question. So a patient is to be infused 1000 ml of 0.9% sodium chloride over 6 hours. Drop factor is 20 drops per ml. Calculates the drip rate of the fluid, and they've already given you the unit. So it's just about picking up the parameters in the question, punching them in the formula, and then you are good to go. It's as simple as that. So drip rate here, total volume, as you can see in the question, is 1000 ml. So let's punch that in it, 1000 ml, all divided by time in minute. So now you can see that the time on here is given in 6 hours. So you've got to convert that into minutes. So you ask yourself, how many minutes makes 1 hour? So you know 60 minutes is equal to 1 hour. So if 60 minutes is equal to 1 hour, then how many minutes will 6 hours give us? If 1 hour is giving us 60 minutes, then 6 hours will give us more. So if more, let's divide. So what it is that we're going to divide 6 over 1 times 60. So 60 times 6 will be how much? Let's punch that into our calculator, and then let's see, 6 times 60 is 360 minutes. So you can see that the time we're getting here is 360 divided by 360 minutes times the drop factor, which is 20. So let's do cross-offs. This 0 cancels out this 0, and now we are left with 1000 ml, all divided by 36 times 20. Let's punch that into the calculator, and then let's see what we're getting. 100 divided by 36 times 20. So we're getting 55 5.555. So the answer I'm getting on here is 5.555. So let's punch that. So this happens to be the answer we getting. So it says a patient is to be given 500 ml of medication over 5 hours. What is the drip rate of the IV fluid? Use drug factor 20 drops per ml. So it's very simple. You think of the formula. Drip rate is equal to the total volume of the medication, all divided by, so this should be in mils, don't forget, all divided by time in minutes times the drop factor, which is all given in the question. So the total volume of the medication here is 500 ml, all divided by 5 hours. But remember, the time should be in minutes, so you're going to convert the 5 hours into minutes. We know every 1 hour is equal to 60 minutes. So if that's the case, then how many hours will be in minutes? So if 1 hour is given us 60 minutes, then 5 hours should give us more minutes. So if more minutes, then let's divide. So 5 is more, then there will be less division of 1 times 60. And then we're going to multiply 5 by 60. And whatever we get is the actual conversion. So let's see what our calculator gives us. 5 times 60 is 300 minutes. Okay, so you just pop 300 minutes on here times 20. Let's get these two zeros out. We have 5 divided by 3 times 20. So let's punch this into our calculator as well. So remember, in the CBT we get a calculator on the side, so it will be much easier for you to deal with that. 5 times 20 divided by 3. So the answer we're getting here is equal to 3.3. So we can just say 3.3. So most times in the CBT question, it will tell you how many decimal places you should leave your answer. If it tells you to leave your answer in a 2 decimal places, then this is it. If it's 1 decimal places, it's just 33.3. If it's a whole number, it's 33, and then that is it. So always look at the question, but this question does not specify, so I would leave this in the 2 decimal places. The next question we're going to look at here, it's also a bit confusing for most people. It is called weight-based dose calculations, where you are supposed to calculate a medication based on the patient's weight. I'm sure you might have come across some of these questions even in your real practice as a nurse, but here we're going to look at how to go about it, especially in your CBT. To be able to calculate for the weight-based medications, there are a couple of things you have to understand, especially the formula. Let's look at it from this perspective. To calculate for the weight-based dose, this is the formula you have to think about. The weight-based dose is equal to the dosage per kilogram times patient weight. So let's look at the example down here. A child weighing 22 kilograms is prescribed 5 milligram per kilogram medication. What is the total dose in milligram? So this is the prescribed dose a patient's weight has been given. How do you get the actual dose in milligram? So let's pick up, normally what I say is that to make it easier for you, pick up the parameters from the question, because if they are still sitting in the question, it makes the whole thing cumbersome and very difficult to deal with. So what I would say is that let's look at the weight of the child. It's 22 kg. That is fine. And then here, the child is prescribed 5 milligram per kilogram of a medication. So let's say the prescribed dose is 5 milligram per kg. In actual sense, for every patient that weighs 1 kilogram should be given 5 milligram of that medication. So if the patient weighs 2 kilogram, that patient is double of this, should be given 10 milligram. If the patient weighs 3 kilogram, that patient will have 15 milligram. On and on it goes. But the question is, this patient weighs 22. How many milligram would that medication be? considering this prescribed dose. So what I would advise you do is that to make it very simple for you, always open up the prescribed dose. For example, you can say 1 kilogram is equal to 5 milligram. When you open up this, that is what it says. So if that is the case, then how much of 22 kilogram of a patient? 22 kilogram is equal to question mark. We don't know for that yet. We can do our cross multiplication, or we can represent this even with S milligram and do our cross multiplication. So what this means is that we're going to look at 1 kilogram times X milligram. 1 kg is equal to 22 kilograms times 5 milligram. And remember, we want X milligram. You want to know the milligram of that dose. So we're going to divide all both sides by 1 kg. 1 kg. So this 1 kg will cross out this 1 kg. This kg will cross out this kg. We left with, let's come on here. We left with X in milligram is equal to 22 times 5 milligram, all divided by 1. So you can just get this off. Now you're going to multiply 22 by 5, and then you know what that is. 22 times 5 is equal to 110 mg. So X here is 110 mg. What this means is that a patient who weighs 22 kilograms will be given 110 milligram of the medication as per what you got on here. So if you could look at this section carefully, it says dosage per kilogram times patient weight. So to make it very simple for you, you multiply the 22 here by 5 milligram, and then you get your answer if you want it as quicker as possible. So here the answer is 110. It's as simple as that. Yes, I wanted to try your hands on. Leave the answer in the comment section, and then let me see what answer you get. What answer did you get? Let's see if it's similar to what you get on here. So it says the patient weighs 70 kilograms and is prescribed this amount. How much drug should be administered? Use the correct unit. So the correct unit here is in milligrams, okay? Now, the formula is dosage per kg times the rate. So we're just going to multiply the 70 by 1.5. 70 kg times 1.5 milligram. You punch that into your calculator, and then you are good to go. And the answer here is 105 milligram. So let's write that in the box. Did you get the same answer? If yes, congratulations, you are there. You really understand whatever has been taught. So now this happens to be the most important formulas we come across so far as your CBT is concerned. But remember, sometimes in as much as you have the formula, some of the things can be turned around. So at least it's just about turning the formula in as well, then getting the correct answer. Thank you very much for watching me up to this point. If whatever has been taught here has been helpful, I want to say I really appreciate you for watching this video to this very end. And I also want to say that there are people out there who are seeking to get this video to be able to pass their CBT exam. So why don't you share? And above all, don't forget to like this video so that YouTube sees the relevance of it and shares it to as many people as they can. If you haven't subscribed yet, I believe that you learned a lot from this video. So use this as a bailout to hit the subscribe button and become part of the family. Hope to see you in my very next video. Bye.